On experience sharing program on managing PPH. Today we have got Honorable Speaker Dr. Bhavin Khambhati with us. Welcome, sir. This
Hello.
program is brought by initiative of Hetero Healthcare. We all know we have got 25 years of excellence with 36 state-of-art manufacturing facilities. We have got 300 plus products in our portfolio and presence in 126 plus countries. Hetero Healthcare has 21,000 employees globally, and we are amongst the largest manufacturers of ARV, APIs, and FDFs in the world. Hetero Healthcare is 360-degree solution provider striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. We are pioneering in quality and innovation, and we have the distinction of bringing 4 biosimilar products to market within 5 years of initiation. This program, experience sharing program, we have got Honorable Speaker Dr. Bhavin Khambhati. Once again, welcome, sir. Dr. Bhavin Khambhati, as we all know, is MBBS MD. Sir is Director Pragati Multispecialty Hospital, Director of Prerna Multispecialty Hospital, Director of Asha Nursing Home, Director of Mamta Maternity and Nursing Home. Sir has presented a poster at annual MOGS conference, conducted MS MD examinations at BGMS Ahmedabad, has participated in various elocution competitions and won awards for the same, have consistently done well in academics all throughout student life, as teaching of nursing staff, MBBS and BHMS regarding obstetrician and emergency management, and sir has conducted several scientific sessions on various social media platforms. Welcome, sir, and over to you the session. I'll be running the slides.
So, overview of PPH, right? Next, sir. Yeah. So PPH is at least 500 ml of blood loss, more than 500 ml of blood loss in a vaginal delivery, and more than 1 liter of blood loss in a cesarean section. PPH is a common and can occur in women who are at high risk, and the leading cause of maternal mortality in low income countries like India and all, and it is a primary cause of nearly 1/4 of all maternal deaths globally. So, sir, should we directly go to this case discussion rather than going for a PPH? Is it okay for you?
Sir, whatever you suggest, we'll do that.
Yeah, better. That is better because
Okay,
I have one surgery planned, emergency cesarean right now.
Yes. I'll go there.
Yes.
Yeah.
Better we'll go for this thing. Yeah, because PPH is, we all know. Yes, fine. We'll discuss the carbetocin, sir. Carbetocin first. We'll discuss back. Yeah, still perfect, and that's fine. Okay, so carbetocin, that is the next generation drugs for PPH management. It is basically a synthetic long-acting analog of oxytocin and used for prevention of PPH due to uterine atony. And it is 1 vial of carbetocin contain 100 microgram of carbetocin in 1 ml of solution of injection. So next. So yes. This is very important slide. This is a comparison of oxytocin versus heat stable carbetocin. As we know, this oxytocin is given in an immediate IV with a peak concentration after 30 minutes, while carbetocin will peak concentration within 2 minutes, and it will lasting for about 40 minutes or 40 to 60 minutes with a rhythmic contraction. Okay, and the half-life of oxytocin is a short acting, so half-life is 1 to 6 minutes, while carbetocin half-life is more than 40 minutes. Okay, and oxytocin require proper storage in a 2 to 8 degree, while oxytocin can be stored up to 30 degree. Oxytocin can be used for induction, augmentation, and prevention and treatment of PPH, while carbetocin only used for prevention of PPH. This is one of the champion study conducted. It's the largest clinical trial for the prevention of PPH by WHO. And sir, next slide. Yeah. So efficacy, the efficacy of blood loss more than 500 ml between carbetocin and oxytocin is almost same, while the blood loss in normal and cesarean, बरोबर है? But the safety is almost same. But I can say carbetocin is better than obviously oxytocin for the uterine. 5 minute रुको. Yeah, sir, next. Okay. Okay, the Cochrane review suggests for women who undergone a cesarean, carbetocin result in a statistically significant reduction in the need of therapeutic uterotonic compared to oxytocin, and also carbetocin associated with less blood loss as compared to methargine in the prevention of PPH for women who have vaginal as well as cesarean. So next. So guideline recommended by WHO for prevention of PPH prophylaxis is only one of the following, like oxytocin, carbetocin, misoprost, methargine, or other derivatives. And the same thing is in SOGC or Germany and FCOHS France. All recommended carbetocin for the use of PPH prevention. So next. Yeah. So now we are going for a case study which is important. So it is presented by me, Dr. Bhavin Khambhati, and the hospital at Pragati. Patient name Priya, 33-year, gravida 3, presented with previous 2 cesarean, and previous seizure was indicated for CPD. She had a gestational hypertension which is controlled, and so she is a high risk for PPH due to repeat cesarean section and PIH. So next slide. So LSCS was done under spinal anesthesia. Delivered well baby. There is a thin lower uterine segment during cesarean, otherwise no operative adhesion. So the PPH risk factor in this is history of previous cesarean, PIH, uterine over distension because of 38 weeks of pregnancy, and risk of uterine atony post surgery. So in each and every case of cesarean, we are using carbetocin, which is 100 microgram IV immediately after delivery of placenta, which causing sustained uterine contraction and reduce the risk of atony. And this is a single dose which is long acting as compared to oxytocin, which we have to use in a multiple doses because of short life half-life. Next, sir. So outcome is obviously uterus form well contracted, intra and post-op. There is less blood loss as compared to average cesarean section, and patient is stable post-operative without and discharge uneventful. So next. So discussion is as usual. Carbetocin is effective in reducing the uterine atony during cesarean, especially useful in repeat cesarean cases with higher chances of bleeding. And that simplifies the uterotonic management in O2E with a one-time single dose. So next. So conclusion. Carbetocin can safely and effectively prevent PPH in previous cesarean section and during cesarean also. Provide consistent uterine contraction with minimum intervention and ideal for high-risk surgical deliveries and resource-limited settings like PHC or anything where the more of the drug is not available. We can provide a carbetocin and reduce the chances of PPH. So next. Okay, so another study is the use of carbetocin in high-risk pregnancy. Patient name is Kavita, 36-year, 4th gravida, presented with 37.5 week pregnancy. She had a 2 prior PPH episode in previous pregnancy. Right now, hemoglobin is at 9.5, and she is gestational hypertension. Induction of the labor done and vaginal delivery planned under close monitoring. Vaginal delivery done after 8 hours of induction and delivered 3.1 kg baby with a good Apgar score. placenta delivered completely without manual removal. So the PPH risk factor in this patient is previous history of PPH, because she was already 3 time delivery, and in which 2 times she was undergone PPH. She is a multigravida, so higher chances of PPH. She is a known case of gestational hypertension and anemia and advanced maternal age. So these are the risk factor for PPH. So we have given carbetocin 100 microgram immediately after delivery of placenta, and that will prevent the uterine atony and PPH in this pregnancy. The oxytocin is not used in this case, because obviously the carbetocin is a single dose efficacy and a longer duration of action. So outcome, what we observe is there is a sustained uterine contraction, strong uterine contraction, and the blood loss is very less. Like it is only 300 ml, which is normally we are expecting in normal delivery is 500 ml. So, and there is no additional uterotonic required in this case, and patient is stable and discharged on 3rd day. So carbetocin shown to significantly reduce the need for further uterotonic in high risk patient also. Even in this case, there are 4 high risk factor for PPH, but a single dose of carbetocin act in a Singham style, I can say. And single dose minimize the risk of missed administration in busy labor ward, because staff is busy with the next delivery. If we forget to give oxytocin in a repeated dose, there are chances of PPH in after few hours also. And this will reduce the nursing load also. Okay, yeah. Next. So discussion is carbetocin shown to significantly reduce the need for further uterotonic in high risk patient. As usual, single dose minimize the risk of missed administration in busy labor room and reduce the nursing burden. So same conclusion, sir. Carbetocin is highly effective uterotonic in high risk pregnancy. Single dose effective in hypertensive, anemic, and prior history of PPH also.
Now we come to panel questions.
Yes, sir.
Sir, is there a patient profile where the doctors can anticipate a PPH?
Yes, sir. See, if it is a previous history of PPH in the patient, if patient is multigravida, it's a twin pregnancy, even IVF conception, gestational hypertension, gestational diabetes, polyhydramnios, even prolonged trial of first stage and second stage of labor. So in that case, we can anticipate even macrosomic means gestational diabetes patient. We can anticipate the chances of PPH in this patient.
Even I think fibroids can also be fibroids.
Yes,
also.
fibroids, any medical condition, even any medical condition, then
Yes.
that can precipitate PPH in the patient. Yes. Even I can share. Sorry, sir, interrupting you. I have delivered one of the doctor's wife delivery 3 to 4 days back. There is a huge fundal fibroid.
Oh.
I'll share the image to the अपने क्या नाम सर का विनोद क्या नाम उसका सर का उसको मैं शेयर करूंगा. Yeah, sir. So it is a huge fibroid, almost 12 centimeter.
My God.
Okay, she had red degeneration of fibroid in 7 months, and almost 10 to 15 times she was admitted to my hospital.
Bapre.
I have delivered at Wokad Hospital, Mira Road, because they stay nearby, and there are chances, and we are planning to go for intrapartum myomectomy also.
Okay.
And some doctor over there, they even Wokad doesn't have carbetocin, sir.
Okay.
So before delivery, before delivery, I asked them, you have a carbetocin? So we have to check, sir.
Correct.
Yes, corporate, we have to check is a common
absolutely,
answer. Okay?
Absolutely. Yeah.
So I don't rely on the. I have taken one carbetocin in my pocket and go for cesarean. And मैंने बोला ये दे देना डिलीवरी के बाद, and immediately, and sir, you won't believe, we have done intrapartum myomectomy, and there is no blood loss.
Oh,
It act
lovely.
like a vasopressin.
Lovely, lovely, lovely.
It
God bless the
act like a
patient. Yeah.
vasopressin.
Yeah.
Yes, because uterine contraction अच्छा हो गया.
And
So
that
it
too, a
like act
fundal fibroid. It's very difficult.
fibroid
Yeah,
ना,
yeah,
तो
yeah.
a good muscle volume in the fundus.
Yeah, yeah.
Okay, so चलो लोअर सेगमेंट है तो एक बार समझो
Yeah,
कि
yeah,
भाई
yeah, yeah.
उसका पर फंडल है, मस्त बड़ा फाइब्रोड है, थोड़ा
अच्छा
सा
हो गया. God
वाजोप्रेसिन
bless.
दिया, पूरा हो गया, एंड
Yes,
एक्सेलेंट
yes, yes.
रिजल्ट.
Good, good,
तो
good.
फाइब्रोड से याद आया कि
Good.
मैं अपने पॉकेट में लेके गया एंड मैंने बोला बाबा तू ये देना है अपने को, एंड दैट टीम इज सरप्राइज, बोले यार
हाँ.
तूने बिना ब्लड लॉस का मायोमेक्टोमी कर दिया साथ में, एलएसएस के साथ में. So that is a
Lovely,
one good
lovely,
incident, sir.
lovely.
Yes,
Yes,
sir.
sir.
Yes, yes, yes.
In which patients would you prefer to use carbetocin? आपने किससे में लिया था तो एक क्वेश्चन रिडंडेंट हो गया.
Yes. Obviously.
Yes, yes. We got the answer with this.
Yes,
Can we use
yes.
carbetocin in
Next.
your experience, sir, in case of retained placenta?
रिटायर्ड प्लेसेंटा, यस सर, डेफिनेटली. उसका भी मैंने एक इंसिडेंस अभी एक हुआ था. वन ऑफ द पेशेंट वाज रेफर्ड फ्रॉम टर्शियरी केयर सेंटर टू
Okay.
माय हॉस्पिटल फॉर रिटेन प्लेसेंटा.
Oh, oh,
ओके, यस. दैट गायनेकोलॉजिस्ट हैड गिवन मिथोट्रेक्सेट.
okay.
उसको रिटेन हो गया है,
हाँ,
क्रीटा सस्पेक्ट किया, उसने मिथोट्रेक्सेट ना
हाँ,
इंट्रा अम्बिलिकल कॉर्ड दे दिया एंड केप्ट
हाँ.
फॉर 2 days. पता
Oh.
नहीं क्या किया,
बाप
आई
रे.
डोंट नो, मैं उसको
हाँ,
काउंटर नहीं किया. हाँ, इंट्रा
हाँ,
अम्बिलिकल ही दिया,
हाँ,
विदाउट
हाँ.
टू द प्लेसेंटल, जो भी
Yes.
प्लेसेंटल साइड अम्बिलिकल कॉर्ड था उसमें.
हाँ,
एंड kept the patient for 2 to 3 days. Patient went in sepsis. As my center is a kind of secondary to tertiary care center, they have referred to me. Patient came with gross sepsis. I have seen, I have scanned it. It turned out to be a kind of bit of the placenta is adherent to the upper segment. एंड तो फिर मैंने आई हैव डन अंडर जीए विथ एमआरपी, मैन्युअल रिमूवल प्लेसेंटा.
हाँ.
बट उससे पहले मैंने मेरे एनेस्थेटिक को बोला तू मेरे को कार्बेटोसिन दे. उसके बाद मैंने 10 मिनट के बाद मैंने किया सर, आराम से मैंने स्वीप मूवमेंट से
Lovely, lovely.
पूरा मस्त रिटर्न प्लेसेंटा निकल गया
Yes.
विदाउट एनी हर्डल्स.
Lovely,
It is
lovely.
removed in the beats, but it is removed because
It's
a
okay.
tight
It's
uterine
okay.
contraction is there,
It's okay. Yeah.
and that is a good thing
Yes.
with carbetocin.
Can we use carbetocin in RH negative mothers?
यस यस यस, डेफिनेटली सर, बिकॉज ऑब्वियसली आरएस नेगेटिव मदर है, ब्लड इजीली मिला नहीं मिला कोई नक्की नहीं
हाँ,
है.
especially
यस,
interiors.
ब्लड
It
इंटेरियर्स में जैसे हमने बताया, जो एक्चुअली लो रिसोर्सेज सेटिंग है, लाइक अगर
correct,
आप नाईगांव में हो, नाला सोपारे में हो, जहाँ पे ब्लड इजीली नहीं मिलता है,
correct,
या
correct.
तो जहाँ
PHC
पे
somewhere.
पेरीफेरी में हो,
Yeah,
विलेज
yeah.
में पीएचसी समवेयर एंड वी आर डूइंग सिजेरियन ना. सो एक्चुअली कार्बेटोसिन ना अभी ऐसा होना चाहिए कि गवर्नमेंट स्कीम में भी होना चाहिए सर,
Correct,
कि
correct.
पता नहीं सप्लाई आता है कि नहीं, बिकॉज अब भी मैं गवर्नमेंट सेटिंग में नहीं हूँ. बट जैसे
Excellent.
मैं जब पढ़ाई करता था तो ऑक्सीटोसिन ही था, बाद में
Yes.
प्रोस्टोडिन आया था. तो ऐसे ही एक कार्बेटोसिन भी इट शुड बी अवेलेबल एवरीवेयर इन गवर्नमेंट सेटिंग, ताकि कोई टेंशन ही नहीं, दे दो काम खत्म.
ये
सो
हमारे
एज यूजुअली
वक्त
आरएस ने.
हमारे वक्त भी खाली
हाँ,
ऑक्सीटोसिन था और मैक्सिमम मिथाइल मिथर्जिन था.
मिथाजिन होता. सो मिथाजिन तो मैं बहुत टाइम से सर यूज ही नहीं कर रहा हूँ. आई ओनली यूज कार्बेटोसिन, एंड एक भी पीपीएच नहीं हुआ, टचवुड ऐसा ही रहे.
गॉड ऐसे ही
एक
रहने
भी
दो, ऐसा ही
पीपीएच नहीं
रहने दो.
हुआ, यस,
ये
ऐसा ही रहना चाहिए, बिकॉज पीपीएच इज
PPH is
ज्यादा
wonderful
प्रॉब्लम.
to discuss, but never you want to see
यस,
it.
एग्जैक्टली.
Can a doctor use carbetocin for prevention of PPH if oxytocin is used for labor induction? We all use oxytocin for labor
यस,
induction.
ऑक्सीटोसिन,
Yeah.
यस यस यस.
Oxytocin has got a
यस, वी
short,
कैन यूज
short half-life. Yeah.
short half life. Yes, oxygen is short half life, as well as almost that it is oxygen on analog of the synthetic
Yes,
analog of the
yes, yes. Same,
this
same
thing.
family it
So
belongs to.
same family, so we can use, sir.
So, have you tried IM route anytime or you prefer IV?
No, I will prefer IV because
IV.
my anesthetic is, yes, my
Oh,
anesthetic is used immediately.
IV.
जैसे बेबी डिलीवर होता है,
Correct.
प्लेसेंटा डिलीवर होता है, एनेस्थेटिक
IV.
तुरंत आईवी दे देता है.
बस
यस,
खत्म.
ओवर, हाँ, ओवर 1 मिनट स्लोली आईवी पुश कर देता है, तो खत्म. फिर वो वही दे देता है मेरे को, तो मैं तो कभी टच भी
बराबर.
नहीं किया, पहली बार टच करके लेके गया पॉकेट में.
But that's if the patient is not responding adequately with carbetocin, होता हुआ कभी भी. Which additional
हाँ,
neuroproteins you prefer?
जनरली नहीं हुआ है सर, बट फिर हम लोग वही ऑक्सीटोसिन चालू कर देते हैं, एंड एक
Pro-
प्रोस्टोडिन दे देते हैं,
yes, yes,
इंट्रामायोमेट्रियल प्रोस्टोडिन दे देते हैं, एंड नीचे वजाइना में साइटोटेक डाल देते हैं, मिजोप्रोस्टोल.
correct.
मिजोप्रोस्टोल वजाइना में डाल देते हैं. बट जनरली आज तक नहीं हुआ है, टचवुड ऐसा ही
Oh.
रहे।
आपने तो रिजल्ट, ये क्वेश्चन बिकम्स रिडंडेंट, यू आर यूजिंग इट एज फर्स्ट लाइन, आपने जो
यस यस यस।
this I want to know, many doctors would want to know, what is the role of anesthetist vis-a-vis a gynecologist in choosing a drug for prevention of PPH? Who decides, the anesthetist or a gynecologist, or gynecologist tells the anesthetist? What is the sequence like?
मतलब जनरली पीपीएच अभी इन माय सेटिंग एनेस्थेटिक है ना,
हाँ,
द एनेस्थेटिक विल डिसाइड अपॉन ब्लड लॉस।
करेक्ट,
बरोबर है, अगर
ओके
समझो
ओके,
पेशेंट का पैरामीटर्स डिस्टर्ब है, लाइक
हाँ
अगर टेकिकार्डिया बढ़ रहा है, हाइपोटेंशन हो रहा है, पेशेंट पेल हो रहा है, ब्लैंच हो
हाँ
रहा
हाँ,
है ना, उसको पाल्पे थ्रेड मतलब हार्ट
पल्स,
रेट 120 से पल्स रेट 120, हार्ट रेट बढ़ गया है, हाइपोटेंशन हो रहा है, देन एनेस्थेटिक विल डिसाइड कि बाबा ये ब्लड लॉस ज्यादा एक्सपेक्ट हो रहा है, 1 लीटर से ज्यादा हो रहा है सिजेरियन में, we require immediate blood transfusion and this thing, as well as gynec जनरली एटोनी पे जाता है कि भाई इतना यूट्रस कॉन्ट्रैक्ट नहीं हो रहा है, अभी तक
ओ
एटोनी
ओके
है,
ओके
ब्लड
ओके,
लॉस एक्सपेक्टेड हो है, यूट्राइन हेमेटोमा है, व्हाटसोएवर। सो जनरली ये हो गया पीपीएच।
PPH,
ओके, सो अभी ड्रग कौन चूज करेगा, ऑब्वियसली गायनेक विल डिसाइड किस विच ड्रग टू गिव,
ओके,
बराबर है, बट देता है जनरली एनेस्थेटिक की सभी हॉस्पिटल में,
करेक्ट करेक्ट,
या तो स्टाफ नर्स देते हैं, बिकॉज
हाँ
ऑब्वियसली
वो तो है,
गायनेक तो बेचारा बिजी होगा
वो
एलएससीएस में या नॉर्मल डिलीवरी में, बट जनरली सब हॉस्पिटल में मैंने देखा है तो एनेस्थेटिक ही देते हैं, बट
करेक्ट,
वो हॉस्पिटल का प्रोटोकॉल होता है कि भाई हमारे हॉस्पिटल में यही देना है,
बराबर, करेक्ट
समझे
करेक्ट
ना।
करेक्ट, एवरी हॉस्पिटल.
सो ऐसा है
This is
तो
Lachit
दैट
lovely. When it comes to gynec issues, our gynecologist will decide. When it comes to blood parameters, an anesthetic will
ब्लड
decide.
पैरामीटर्स
Yeah,
एनेस्थेटिक विल डिसाइड कि भाई ये
correct,
पीपीएच हो रहा है,
correct,
वी
correct,
हैव टू
correct.
गिव दिस
Intervention
ऐसा
चाहिए.
इंटरवेंशन, यस
Yeah.
यस यस।
Now to conclude, sir, what is your take-home message to the audience on carbetocin?
सी जैसे मैंने पहले ही बोला सर, कार्बेटोशिन, सी एज आई एम प्रैक्टिसिंग इन मेट्रो मेट्रो एरिया, राइट, इट्स ए बिग दहीसर है,
Yeah.
बोरीवली है, सो इट इज ए, वी आर इन वर्किंग इन मुंबई, सो इजी अवेलेबिलिटी ऑफ ब्लड, even we have a lot of staff also जो which are dealing with in case emergency in case of PPH, but लो रिसोर्स सेटिंग है, लाइक गवर्नमेंट हॉस्पिटल्स है जहाँ पे स्टाफ कम है या तो पेरिफेरी में है, ये सब जगह पे कार्बेटोसिन शुड ओनली बी यूज फॉर ए फर्स्ट लाइन मेडिसिन फॉर प्रिवेंशन ऑफ एंड प्रोफाइलेक्सिस ऑफ पीपीएच, बरोबर, बिकॉज मैं ऐसे प्राउडली बोल सकता हूँ अभी तक मेरे हॉस्पिटल में लास्ट, जब से मैंने कार्बोटोसिन यूज करना चालू किया है, आई इवन मतलब बीलिंग सुचर का या तो कोई भी और इंटरवेंशन का जरूरत नहीं पड़ा है,
What
एक्सेप्ट
is?
कभी कभी हम लोग यूट्राइनेटरी लाइगेशन
Okay.
करते हैं, अदरवाइज एक भी इवन इवन आई when I was junior, I used to assist with I used to take assistant from my senior doctor, Dr. Jignesh Kansaria है, but now I'm independently doing cesarean since 7 years, एंड मेरे अभी एक गायनेक एसोसिएट है, फीमेल जूनियर है, आई एम ओनली ऑपरेटिंग विद हर ओनली, लास्ट डे आई हैव डन सिजेरियन ऑफ 120 kg फीमेल
Oh my God.
with polyhydramnios, GDM, hypothyroidism, and PIH, grossly obese female, and she was uneventful without any problem.
Yes, God bless.
Even one case I will discuss, sir. It's very important. I have done cesarean of transverse lie,
Oh,
वेरी डिफिकल्ट
yeah,
सिजेरियन,
yeah,
बेबी इज
yeah.
नो, बेबी जैसा बेबी एलएससीएस किया, बेबी का हाथ बाहर आ गया, खत्म, अटक गए,
Yes.
फुल टर्म बेबी 4.3 kg बेबी फुल
My
टर्म,
God, huh?
हाँ, ट्रांसवर्स लाई, बिग बेबी, बिग मदर, एंड देन एम ऑब्वियसली वी कैन नॉट, मैंने ट्राई किया हेड निकालने का, लेग निकालने का, कुछ भी नहीं हो रहा था, देन आई हैव गिवन इन्वर्टेड टी,
Oh,
थोड़ा सा इंसिजन, यस,
huh, huh.
एंड बेबी डिलीवर, फिर वो थक गया कि गायनेक थक गया लगता है, अपने से बाहर आ जाती हूँ। Then baby came out. Okay, baby is well, baby is well, and
Wonderful.
immediately carbetocin is given. No PPH, बेचारा अपर सेगमेंट के मसल कट हुए तो भी बोला मैं कॉन्ट्रैक्ट होता हूँ, मेरे को
Arey, that's lovely.
कार्बेटोसिन मिला है।
Upper segment contraction is great, huh? Upper segment contraction
हाँ,
is great.
नहीं नहीं,
Yeah.
and still you know carbetocin works well and with a single layer, sir, even sometimes bleeds like na, because
Yes,
upper
yes,
segment
yes,
है
yes,
तो
yes, yes.
it bleeding even
Yeah.
suture also, but muscle contract हुआ, सिंगल लेयर में क्लोजर हुआ, टीएल करना ही था, पता था, तो टेंशन नहीं था कि फ्यूचर प्रेगनेंसी का,
Yeah, yeah, yeah.
क्योंकि थर्ड ग्रेविडा थी, प्रीवियस टू
बराबर.
सीजर था, वो भी प्रीवियस टू सीजर भी था, वो
Oh
प्रीवियस टू सीजर ऑब्लिक लाई, वेरी
my
डेंजर,
God.
ब्लैडर इज एडवांसली अधरंट, तो बट नाइसली डन,
God
baby
bless.
is well, but
Yeah.
thanks to Carbetocin कि वो अपर सेगमेंट कॉन्ट्रैक्ट हो गया ना सर, तो वो ब्लीडिंग नहीं हुआ ज्यादा,
Correct, correct.
तो
Good,
ब्लड
very good.
लॉस लेस देन व्हाट वी डिड इन नॉर्मल सिजेरियन, बिकॉज एक तो लोअर सेगमेंट कट किया है, फिर थोड़ा अपर सेगमेंट मुझे एक्सटेंड करना पड़ा
Invert TB करना
to
पड़ा.
deliver
Yeah.
the baby. Yes,
Yes,
to
yeah.
because baby delivery is upon first priority. Otherwise,
Yeah.
everything else we can manage.
Correct, correct,
ऐसा है.
correct.
So obviously overall experience is excellent. I can give 5 upper 5 star. ऐसा है.
Sir,
इसके
thank
लिए.
you so much. It was lovely, your webinar. I mean, you shared the cases. I'm sure the audience must have benefited out of it. Thanks once
Yes,
again, sir.
yes.
Thank you once again.
Thank you
It's
so
been
much.
nice
Thank
being
you,
with
sir.
you.
God
Thank
bless
you.
you.
Yes,
Yes,
and
yes. Thank you,
thanks
sir.
all
Thank
the
you. Take care.
audience. Thanks marketing team, sales team, and IT team Hitro for this coordination. Thanks very
Hmm.
much. You can
Thank
sign
you
off,
so
sir.
much.
You can sign off.
Yeah. Thank you. Thank you.
Thank you. Thank you.
Thank you. Bye.
Thanks, Bivas. Thanks, Sanjana.
Thank you, Sanjana. Thank you, Dr. Prashant.
Thank
Thanks a
you.
lot. Yeah. Thank you.
Thank you,
Bye.
everyone. Thank you.
अच्छा हुआ ना? Very
Yeah.
nice.